While COVID-19 is no longer considered a global health emergency, the director of the World Health Organization is reporting some startling numbers. In the month of December, there were almost 10,000 COVID deaths. Hospitalizations were up 42% since November, and during the same time period, admissions to the ICU were up 62%. The trends are based on information reported to the WHO from fewer than 50 countries, leading researchers to believe that this situation could be worse. Well, this report comes on the heels of 2 days of testimony by former Chief White House Medical Advisor Dr. Anthony Fauci in front of a COVID Select subcommittee. He faced questions about the COVID-19 pandemic and offered his thoughts on preparing for potential outbreaks. And for more on Dr. Fauci's testimony, let's bring in Dr. Kheriaty of the Ethics and Public Policy Center. Good to be with you. Dr. Fauci's testimony, it was behind closed doors, but Chairman Brad Wenstrup issued a statement with some of the takeaways from the testimony. What stood out the most to you?
So the first thing that stands out is that Dr. Fauci seems to have a kind of situationally induced amnesia, especially when he's under oath. So Fauci claimed that he did not recall pertinent things that he had done, decisions that he had made, the scientific justification for policies that he supported. He said he didn't recall over 100 times during that testimony, and the testimony transcript has actually been made available publicly now. And it turns out he did the same thing about a year ago. In the first time that he was having to testify under oath was a case that I'm involved in as a plaintiff, the Missouri v. Biden case that's currently before the Supreme Court, challenging government censorship. And we know that the NIH and Fauci and director of the NIH, Dr. Collins, were involved in censoring disfavored opinion or people who criticized our government's COVID policies. And during that deposition, he said that he didn't recall 179 times when asked very similar questions. So I suppose this week's testimony represents an improvement. He went from 179 to only 100 I don't recalls or I don't remembers. But the fact is he's trying to dodge and evade giving reasons for his previous leadership decisions and for his previous policies and the things that he said publicly, the things that he put in emails and are now part of the public record or have been placed in the public record because of subpoena or discovery in cases like Missouri v. Biden or in his congressional testimony. So what we have here is a leader who's really being evasive and refusing to stand up and answer questions about decisions that he made that obviously impacted millions of lives here in the United States and even influenced COVID policies abroad when many other nations were looking to the U.S. for guidance.
Yeah, and one of the key takeaways from day 2 of his testimony, this is according to Wenstrup's press release, was that Dr. Fauci did indeed advise universities to impose vaccine mandates on their students. I know you were at UC Irvine at the time and you were fired because you didn't comply with the school's mandate. That said,
that's right.
How effective do you think those mandates were? Or did they do more harm than they did good?
Yeah. Well, this is not a matter of opinion now. This is a matter of the scientific evidence, which shows that vaccine mandates and places that instituted vaccine mandates did not have overall better COVID outcomes in terms of morbidity and mortality. And what they did have instead was downstream harms in terms of people losing their jobs, and economic stress and loss of employment has long been known to be a major risk factor for all kinds of negative health outcomes. So the vaccine mandates did not produce any positive health outcomes, but they have produced documented negative health outcomes and negative social outcomes as well in terms of the difficulty with among many in the population now in terms of trusting the public health authorities. And so we have a situation now in which we've had an enormously damaging policy. And instead of recognizing the damage that was done, taking responsibility for that, reassuring the public that that type of policy is not going to be instituted again in the future, we have those responsible for those policies evading responsibility and evading answering questions and evading explaining themselves, period. This is not a sign of sound and healthy leadership.
Dr. Kheriaty, thank you so much for coming on. Appreciate your time.
Thank you.